Hi everybody, I'm Miss Brienne, one of the owners of All About Speech and Language, and in honor of Childhood Apraxia of Speech Month, in tandem with Better Hearing and Speech Month, today we wanted to highlight apraxia of speech and share some more information about this developmental disorder and how we work with clients at our office who have it. So first off, an appropriate question to ask would be, what is childhood apraxia of speech? And the best way to answer this question is to understand first how the brain works to communicate. So the brain must first send a signal from our brain to our mouth in order to get our mouth to move our muscles and do what it needs to do to make various sounds. And children with apraxia of speech have a hard time with the brain making the connection to our lips, to our tongue, to our jaw, to coordinate all those specific movements, to make sounds, to put sounds in words together, and to obviously then put those words into sentences. I love to give the example of using one of those inflatable water slides. My daughter has one and she's obsessed with it. In order for the water slide to blow up and inflate and to have that fun water come down so she can go down the slide, we have to make that connection first by plugging it into an electrical outlet. And from there, the slide begins to inflate, the water comes down, and she can have fun. So again, children with apraxia of speech, if we're thinking about it with this example of a water slide, that connection's there, the electricity is going on, it's getting plugged in, but somewhere along the lines, the slide isn't able to fully inflate, so it's not necessarily working correctly. The water might be coming down, but then if we can't climb the slide to go down it easily, things are just all uncoordinated. So I like to just give that as an example, just sometimes not using all this technical jargon of brain, mouth, articulators, and things like that. So I like to also highlight for families that children with apraxia know what they want to say. It's not a disorder where they don't have the cognition or they don't have those skills from a thinking standpoint. They know what they want to say, and it's not necessarily that they have this weakness in their mouth. It's connection, it's that firing from the brain to get the mouth to coordinate to move all those sounds. And then from here, the next question we would ask is, what are the signs and symptoms of childhood apraxia of speech so that I can be on the lookout for them? Or if I am concerned, am I seeing some of these things at home that would then warrant getting my child evaluated? And so a couple things that we see, and again, just like any disorder, they're not consistent across all children. But some of the things that we see are consistent distortions with sounds, not saying sounds the same way every time, not saying words the same way every time, difficulty with stressing syllables within words, again, distorting and changing sounds, and then more often than not, the ability to say shorter words is easier for them to say longer words. So those multi-syllable words are much harder than those shorter words like go, up, cat, pop, things like that. Children with apraxia of speech might also exhibit gross motor delays and fine motor delays, which would warrant seeing an occupational therapist. They may also present with some language delays. And then also as they grow and develop, they might have an impact on reading and writing skills just because of the delays with expressive language, their sound sequencing, their ability to learn sounds within words. It might later affect their literacy development. So things that we will be on the lookout for in getting started with a plan of care and assessing them and monitoring them based upon their age and their development. And then the last question is, so what do I do? How can a speech pathologist help me? Well, we are the professionals to see, from doing an assessment to coming up with that plan of care and treating your child. And always know, again, here at ASL, we are here to help in any way we can. We're going to do the assessment based upon your child's age, how they're presenting developmentally. We're going to look broadly across their speech skills, their motor planning. We're going to look at their language skills, and then identify, again, their strengths and weaknesses and come up with that plan of care. But this also is going to require that we work closely with our families. We want you a part of therapy. We want you in the sessions with us because in working with children with apraxia of speech, we also then need to know what are the routines that are important to your family. What are the preferred toys, the preferred foods, the things in their environment that light them up, because we're going to use these things in our therapy so that it's functional, it's appropriate, and we can help them succeed in all environments. And with that, there's a variety of approaches out there in terms of cue cards, tactile techniques, things like prompt therapy, DTTC, and we will use a variety of these programs and layer them in and customize what's going on so that we can help your child grow and develop and get talking so that they can have fun, they can express themselves, they can connect with peers around them, and most importantly, with their parents, their caregivers, and their loved ones. So if you have any questions about childhood apraxia of speech, again, it's their awareness month this month. We just wanted to do this short little video more on what is it, what are the signs and symptoms, how can we help? And again, if you have any questions, do not hesitate to reach out to our office, and we're happy to set up a call and answer any questions that you may have. Take care, and we'll talk to you soon.